There is now new hope for patients with advanced bladder cancer. Here with the details on the first treatment approved for people with advanced bladder cancer in more than 30 years is Dr. Arjun Balar, medical oncologist, as well as Kevin Williamson, a bladder cancer patient. Good morning to you both. So great to have you on the show this morning.
Good morning. Thanks for having us.
Good morning.
Dr. Arjun Balar, how many people does bladder cancer affect?
So bladder cancer is actually a fairly common disease in the United States. It's often actually under-recognized, but it's actually the 5th most common cancer in the United States. An estimated 76,000 Americans will be diagnosed with this disease every year, and about 10% will be diagnosed in its most advanced stages, i.e. stage 4 disease.
Wow, and Mr. Williamson, you are actually a bladder cancer patient. What was it like when you were first diagnosed?
Well, it was a little overwhelming at first, and you just got to kind of get your bearings and figure out what your options are. When I was first diagnosed, there weren't too many options, but as time went on, some of these trials became available, and Tecentriq is something that I've been on for 2 years now and done very well with.
What are some of those signs and symptoms maybe you first noticed or that we should be looking out for?
Yeah, so bladder cancer patients, the first symptom that patients will often first present with is actually bleeding in the urine. Sometimes it's associated with pain, but very often it's actually not associated with any pain at all, just simply bleeding. However, as the cancer progresses, it can lead to pain in the pelvic area or the lower abdominal area, and subsequently other symptoms such as fatigue, loss of appetite, weight loss, and pain in the bones can also develop as the cancer progresses.
And Kevin was talking about the way that he is being treated. Would you recommend that kind of treatment, or what should we be looking forward to as far as with new medicine and how that's approved and the way that it affects treatment these days?
Right, so that's why we're here. We're really excited to talk about a new class of treatments called immune therapies. One particular drug that is one of those types of treatments is called Tecentriq. And we're here on behalf of Genentech to talk about bladder cancer as a whole and also where this disease has been in the past and where we are moving forward. Not a lot of advancements over the last 30 years. We're still using the same chemotherapy drugs from the early 1980s. And until recently, not a lot has changed in terms of how well patients did with this cancer, frankly, in terms of how long they lived with it. What Tecentriq represents is a major breakthrough in the sense that this is a new form of cancer therapy. It harnesses the body's immune system to help fight cancer. It's FDA approved now in the second-line setting, which means patients who previously received chemotherapy, and it's a standard of care. It's important for patients to talk to their physician about this type of treatment to make sure to see if it's right for them. But as a researcher in this disease, this is a major breakthrough.
Thank you both so much for taking time to chat with us. Kevin, by the way, you look great. We hope you are feeling great and hope that this treatment continues to work for you. So anywhere you want to send us online as we close to learn more about bladder cancer and treatment options.
Absolutely. Proud organization that we're working with is the Bladder Cancer Advocacy Network, supports research as well as patient advocacy. Their website is www.beacon.org, spelled BCAN.org. And of course, the American Cancer Society has a wealth of information. That's www.cancer.org.
Thank you both so much. And for more information, head online to our website. We've always got a wealth of information there as well, fox4morningblend.com. Okay, we all know first impressions are everything. Coming up next, Swan Center says they can take years off your face. See those results next.